As my opponent just stated, economic reasons are the why they want to lower the drinking age. Well, according to my statistics, the rate of alcohol consumption among underage drinkers is going down due to the higher drinking age. So if we lower it, money will go down. I'm going to start by stating some reasons why we want to keep the drinking age at 21. Minimum drinking age 21 laws save 900 lives per year in reduction in traffic fatalities involving young drivers. Emerging medical research shows that the brain is not fully developed until about age 25, and excessive drinking by youth under age 21 may cause brain damage as well as reduce brain function. Early onset drinking increases the risk for future alcohol abuse problems, crashes, and assaults. And European countries who have already lowered their drinking age have higher experiences of percentages of youth that report intoxication in the past month. At least 50 peer-reviewed minimum legal drinking age studies in the United States concur that a higher minimum legal drinking age is effective in preventing alcohol-related deaths and injuries among those 18 to 20. When the MLDA, otherwise known as the minimal legal drinking age, has been lowered, injury and death rates increase, and when the MLDA is increased, death and injury rates decline. Additionally, evidence shows that while many youth under the age of 21 still consume alcohol, they drink less and experience fewer alcohol-related injuries. A committee developed to strategically find a solution to this has been working for over 20 years, and not one of them suggests that lowering the drinking age to 18 is a solution. In fact, several, if not all of them, believe that what my research concurs, that lowering drinking age will increase the problem rather than solve it. As my opponent stated again, binge drinking is among the highest problem in colleges and among youth. It is defined, as she stated, as consuming more than 5 alcoholic beverages at one sitting. Binge drinking dropped significantly when the minimum drinking age limit went up among college students in the United States in the 4-year period between a recent study by Dr. Harry Wessler of Harvard and his earlier study. He also found that the proportion of college students who abstain from alcohol jumped nearly 22% in a short period of time. Clearly, a higher drinking age lowers binge drinking rates. In 2001, there were approximately 119,500 alcohol-related visits to the emergency department involving people under the age of 21. My opponent was concerned that lowering the drinking age would allow less hazardous situations to be reported in fear of getting caught. So clearly, they're still reporting to authorities and still getting aid. Additionally, if we lower the drinking age, a trickle-down effect to lower age students will occur. As stated by the Journal of Studies on Alcohol supplement, there is a trickle-down effect when youth get alcohol. They often give it to younger teens. If the drinking age is 18 and 19, then 17 and 16-year-olds, and even younger, have easier access to alcohol. Additionally, in the United Kingdom, 1 in 7 people taken to the hospital for binge drinking last year were under the age of 14. They are among the many countries that have lowered their drinking age. When New Zealand lowered its minimum purchase age of alcohol from 20 to 18 in 1999, they discovered that the change there were increased trips to emergency departments due to intoxication of 15 and 19-year-olds, once again indicating this trickle-down effect. According to Stephen Rowland, clinical director of Rutland Studies Clinic in Dublin, alcohol among young people is reaching epidemic levels in Ireland, yet another country that lowered their drinking age. A massive 50% of increase in alcohol consumption rate among teens is to blame. In 2007, the U.S. Surgeon General estimates that approximately 5,000 persons under the age of 21 die from alcohol-related injuries involving underage drinking each year. If the drinking age was lowered, this fact would increase. Lowering the drinking age to 18 causes more fatal driving accidents among drivers 20 and younger. According to the effects of minimum drinking age laws, review and analysis of the literature from 1960 to 2007, In 57 states, a total of 102 crashes outcome measures were analyzed and found that a statistically significant inverse relationship between the legal drinking age and crashes. That is, as the legal drinking age was lowered, the number of crashes increased, and as the legal age was raised, the number of crashes decreased. If the numbers of non-drinking drivers and fatal crashes remain constant between the before law period and the after law period, then these percentages would simply represent the percentage reduced in the number of drinking drivers following the implementation of the law, because the denominator in the odds measure, non-drinking drivers, would cancel out. Lowering the drinking age, there are good reasons to treat 18-year-olds differently for different purposes. Responsibilities they are ready for, others they may not be. As I stated, they're responsible enough to vote, but not responsible enough to drink. They also stated that no one follows the present system, and they find a rebellious means of outcry. Well, if we reduce the legal drinking age, those lower age students would feel the same way and want to rebel as well. Reducing the legal drinking age would not prevent underage drinking, and the present system works. If the current system is not being followed, how the new system is going to be followed? If the drinking age is reduced to 18, we will be fixing a system that is the best way to improve the underage drinking problem. Keeping the current policy prevents injuries and death, as I have stated previously, among underage persons. Evidence shows that while youth under 21 years old still consume alcohol, they drink less and experience fewer alcohol-related injuries and deaths when the legal drinking age is 21.